Hello everybody, I'm Dr. Nandini Ray. I'm a senior consultant ophthalmic surgeon and I've been practicing at Fortis Medical Centre. What a very interesting question is, oh but doc, I always thought that, I should come to you only when I can't see at all. Well, that's a myth. I've often been asked, what is cataract surgery sort of now as compared to 40 years ago? 30 to 40 years ago, we would perhaps wait for a certain degree of advancement or maturity of the cataract. But now with the advent of phacoemulsification, which we have been doing over the last 30 odd years, we do not wait for maturity of a cataract. In simple words, I tell my patients, it's not like a mango, you wait for it to ripen and then you eat. It depends on you. I have patients who are golfers. I have the discerning patient, the well-heeled patient who is up and about and who wants to have excellent vision. They've actually come to me saying that, I want a cataract surgery when their vision has just dropped about 10 to 15%. So they are not looking at a complete drop in vision, or they are not looking for a 50% drop in vision. They are looking for perfect clarity of vision. So it depends on what you want. It depends on what you need. There are people who need outstanding vision. There are people of a senior age who want to say that, I'm doing quite well, doc. I don't think I need cataract surgery as yet. I'm not really having any problems. Thank you for letting me know that I do have a cataract, but would you mind if I came back in 6 months to 1 year's time? So the most important thing that I tell patients is that you will come to me for cataract surgery when you feel the need for better vision, or you will come back for cataract surgery when I actually tell you that you are not feeling the need for cataract surgery, and that is wrong. You are not going to be allowed to wait for maturity of a cataract. You need to come back for cataract surgery at the earliest possible opportunity. Again, I often tell my patients that, cataract surgery, you need home help, you need family support. It's not a skin biopsy where you can just walk in and walk out. It often depends, that cataract surgery is sort of based around whether my children are going to be coming from abroad, or my children are going to be coming from outstation, or my daughter's getting married, my son's graduating. So everything, being seen to and dealt with, you need to do cataract surgery when it is socially convenient for you as well. Modern treatment of cataract surgery, we've been doing phacoemulsification for a very long time, almost 40 years now. Phacoemulsification has evolved a lot in the type of technology that we've been using. As far as the phaco equipment that we are using, at Fortis we are using the Centurion zero gravity fluidics. And this is the best phaco machine that I've ever used in my life. I can almost do a cataract operation, and I'm sure many of my fellow colleagues will say, with the greatest possible ease and with the greatest possible comfort for the patient. The patient practically is being operated in a topical anesthesia. I haven't given an injection for the last 18 years. So I'm doing cataract surgery under topical anesthesia, which is drop anesthesia, which is very atraumatic, and the patient practically doesn't feel anything. So the phaco equipment has become very much more advanced. And as far as intraocular lenses, there's been a huge technological leap forward where we have progressive lenses, we have trifocal lenses. Over and above trifocal lenses, we have the EDOF lenses, which is the extended depth of vision lenses, giving a great intermediate vision. Now, these lenses come at a price. If the patient wants the added advantage of an intermediate vision without having to pay the price, we have an enhanced monofocal lens. And of course, we have the bare minimum, which is the monofocal lens. We give the most, the US FDA approved lenses, usually the best of the best. Everything is very, very transparent. We give the lens box after implanting the lens so that the patient is aware of what lens they've given and what they've been promised. We deliver what we promise. We always aim to do that. And so even with a monofocal lens, your long distance vision improves, but you will be left with glasses for intermediate and reading vision.